Hello, I'm Dr. Lynn Gerner, chiropractor, lactation consultant. I have a very fun specialty of supporting breastfeeding through cranial work and through chiropractic care. I'm also a international instructor. I'm a wife, mother, grandmother, and guess what? I am an absolute anatomy geek. I love this stuff. So welcome to Geek Out with Dr. Lynn. This time we're going to talk about a really fun specific part of cranial anatomy called the sphenobasilar joint. Okay, just to show you what I'm talking about here. Here is my skull. I've taken the top of the head off and we've flipped it upside down and you see the interior of the cranium, just like what you see on your screen in the diagram. That's what this is depicting. And as you can see, the union of these two bones, this is called the sphenoid, is a bat-shaped bone in the interior of the cranium. Really cool. And the back of the head. If we're looking at an infant, the back, the occiput right here, the back of the head is this bone right here called the occiput. And where those two meet in the interior of the cranium is a joint. Now, the take-home message here, which makes it super cool, is that with the newborn, actually up until about, 10 years of age or so, this is a movable joint. So if you can imagine, if this is the front half of the head and this is the back half, it allows it to move. Okay. And the reason, there's a couple of reasons for that, but the main one is for protection. It's an amazing thing with just the body's creation in that imagine the forces of birth. Those of you who are parents, those of you who are birthing parents, think about the experience of your baby and perhaps a long extended labor, lots of force, obviously, on that little head. If there wasn't that motion in the middle of the cranium, there would be a lot more damage, neurological damage, harm done to the baby as it's being born. Now, again, this is the back of the head. This is the base of what's called the occiput. This is that interior bone called the sphenoid, and the sphenobasilar joint is where they meet right there. And as I mentioned, this is a movable joint right here. This is an occiput, my little model. This is the sphenoid, and there's motion. It can move in various ways, like so. Isn't that cool? So when we see things like this is what it looks like. We lay people call this sometimes a cone head. That's from literally being pulled, the head being pulled during the birth process. And if you can imagine, that is what this joint is doing right there. As the occiput comes down, the sphenobasilar joint is flattening out. Now, why do you care? Why is that interesting? This baby is probably going to have a hard time breastfeeding. The things that this affects, things like the jaw alignment is altered. Definitely the palate. In videos to come, I'm going to tell you all about the palate and about the alignment of the cranial bones that make the palate. And I can guarantee you this little one with this shape of a head has a very high palate because the palate sits right in front. But we're going to talk about that later. Here's another example. This is where the occiput has literally been shoved forward, squished like an accordion. I like to use that analogy in my classes sometimes. And that's where this very flat back of the head happens. Also, a lot of trouble breastfeeding, usually, again, with not only brainstem and nerve compression, but misalignment of the jaw, misalignment of the palate, just to say a few things with this scenario. So I'm not going to take the time to read this because we're trying to make this short, but stop the video, read all of these things that come along with these particular head shapes, and know that if your baby has had a traumatic birth and has a misshapen head or distortion patterns, I like to say, that there is help and very likely breastfeeding function being restored as a process. Now, if this was interesting to you, I invite you to go to my website, thegoodlifelearning.com. There's a free course that's only about a half hour that goes into this and a whole lot more. If you're a lactation professional or a chiropractor, you can see where my online courses and locations are coming up. And if you're in the Sacramento, Davis, California area and are looking for a care provider, that's where my clinical practice is. I would love to take care of you and help you with your breastfeeding journey. Thank you so much.